Hey everyone, it's Marianne from the New York City Organization of Public Service Retirees. I want to share a little video with you. It's actually an audio, but we put it to Mr. Garrido's face because it is from Mr. Garrido from District Council 37. We thought you might find it interesting. I know we did. We did do a little bit of a background check on some of his data points, but we do want to also clear up some of that as well. So
the stuff we're talking about, we're now seeing the consequences now of a deal that was done in 2014. 2009, $169 million came out of the stabilization fund to save 672 school aides. And then they got laid off anyway 3 months later. 69 million came out, $112 million in perpetuity came out. That was the worst deal that I ever seen in the union do. Because you gave it all and you got no guarantees back. Those people who got laid off, many of them became retirees, are now being hit again for something they did. So you're not going to get a disagreement with me. But the problem is, what we have in front of us is what we have in front of us. There were a lot of problems with MA. It was one of those ideas that came out. It was a big chunk of the ideas. Clearly, it wasn't well thought out. There were some changes and some things that had to do. The fact that we have to do better in terms of how whatever plan comes out of it cannot be on the back of working people or retirees for that matter.
So let's break some of that down. The layoffs that he was referencing wasn't just the title that he was mentioning. It was also the United Federation of Teachers, and it was firehouse closings. So we can track some of those documents, some of those stories going back into the Daily News and the Chief Leader. We can also show you that it wasn't $160-something million. Actually, what did come out of the stabilization fund was $18 million to defer layoffs. They called it a deferred layoff, was $18 million. And according to the 2009 health benefit agreement, from the MLC, that they put a dollar figure, like a cap of up to $20 million cost to defer those. That was kind of a crazy decision that was made at the time, but that's what was made. And then ultimately those people ended up getting laid off. The United Federation of Teachers at the time, and we should probably do a separate video over that they ended up taking a separate agreement and moving away from the MLC agreement and negotiated their own deal to save their workers without doing that within the larger group. But we can show with the Health Insurance Stabilization Fund, it was $18 million. And then, yes, there is a $112 million in perpetuity, forever and ever, money coming out on an annual basis from the stabilization fund based on that 2009 agreement. Now, if I'm going to show you that agreement, I also want to explain to you, and we will be coming up probably with more little videos about Michael Mulgrew making these agreements to sell off the health benefits and reduce the HIP rate and sell off other insurance. But this agreement actually changed healthcare. So if you see, for example, I think it was in 6 layoffs, it says layoffs, including those originally scheduled for June 13th, June 27th, and July 11th of 2009, respectively, and others identified by mayoral agencies, departments of education, health and hospitals, and the office of elected officials, including the community boards, between the date of this agreement and July 30th, 2009, affecting permanent, competitive, non-competitive, and labor class employees shall be deferred for a period of 90 days from the date of layoff would otherwise be scheduled to occur. The cost of this deferment shall not exceed $20 million and shall be withdrawn from the stabilization fund and the trust and agency account funds. In the event the total cost of this deferment exceeds $20 million, then the parties will meet first and attempt to identify the funding necessary to cover the additional costs. Layoffs shall not be deferred unless sufficient funding mutually agreed upon has been identified. Now, there's also these healthcare issues which also stemmed from this 2009 agreement, which shows you how far back that they were looking at changing healthcare. So provisions of the Medicare Modernization Act and related to the New York City health benefits, reconfiguration of the current structure for providing prescription drugs, funding and savings opportunities to enhance resources to the Health Insurance Stabilization Fund, benchmark and savings in Medicare programs. So this is like a full-fledged lie when you hear Michael Mulgrew say that there was the the HIP VIP plan there was no benchmark in a Medicare plan. It didn't exist. The benchmark is equal across the board. Everyone, it's for the HIP HMO. Whatever the HIP HMO is what the city has to pay up to. Health benefit cost containment with the goal of achieving additional recurring savings. I mean, they've been trying to get money out of unions for a very long time. If you go back to, and of course, they were still pulling money out of out of the stabilization fund for welfare funds. Here is where it says the Health Insurance Stabilization Fund Trust and Agency account funds will guarantee an additional $112 million generated through the modifications referenced in Section 3 to the city on an recurring annual basis commencing July 1 of 2009. Now let's go up to number 3. Three shows health benefits modifications. GHI, Blue Cross Blue Shield, Senior Care Program. The following modifications will be implemented as soon as practicable. Institute the Blue Cross CBP PPO hospital network for the current Blue Cross hospital program. Implement minimum premium funding arrangement. GHI subcontracting coordination of benefits. Establish subrogation procedures for the Blue Cross hospital program. Institute Blue Cross PPO freestanding ambulatory surgery facilities network. Institute Blue Cross PPO freestanding hemodialysis facilities network. Establish a $50 emergency room copay for Blue Cross Senior Care Plan waived if the patient is admitted. This is the first time that there was ever a copay initiated. And of course, what do? You smack it on someone who's a senior needing the hospital, even if they're not admitted, knowing that hospitals don't always like admitting people. If they can stabilize you, they'll let you go. But if a senior is going to the hospital, there must be a reason. Your HIP HMO program, this is where they started to play with the HIP HMO and started putting copays for inpatient hospital admission, established a $50 copay for ambulatory surgery, the elimination of the preventative dental benefits that were in the HIP HMO program. This was the first time that they started to degrade HIP, and HIP is the benchmark. Why would you suppress it or degrade it? Now, this was 2009. Remember what happened in 2017. The Medicare reimbursement rate, that federal funding that Michael Mulgrew keeps talking about, when Medicare, CMS, reduced the amount of money that was being paid to Medicare Advantage plans, and HIP VIP is a Medicare Advantage plan that was born in 1987, then what happened was the city was told by HIP. HIP said, hey, listen, city, the Medicare people are paying us less money for this Medicare Advantage plan, HIP VIP. You got to pay us the difference in premium. And the HIP said, no, I'm not doing that. HIP said, well, you better do something. You better get it out of those retirees. City said, nah, we're not doing that either. HIP said, well, okay, according to the contract, you don't pay me the additional money, even though the feds are reducing what they're paying me, that capitation rate. Well, then we just got to change the plan. They carved out the drug plan. They put copays on. They doubled them, almost doubled them where they existed and added them where they didn't. That will happen again when you put managed healthcare in the lives of New York City retirees. Then what happens if you're basing that your costs are reduced based on federal subsidy, whenever that subsidy changes, and it's going to change, if the city refuses to pick up the balance, it gets passed on to you. If you don't pay it or the city doesn't pay it on to you, pass it for you to pay, then what happens? Then the insurance company reserves the right to change the plan. And that's exactly what happened to the HIP plan in 2017. And it will happen again. So sorry, Mr. Garrido. Also, I have to say, you knew that this was a problem. Clearly, you're recognizing in this audio that you admit that the 2014 deal was a bad deal. Medicare Advantage shouldn't be put on the backs of retirees to fund your healthcare program. Then I have one question for you, sir. Why are you still pushing it? Because you have the ability to walk this back. You have the ability to say what was told to you, what was promised to you, what was given to you isn't what ended up being in the contract. Sounds logical. So why are you still forcing this plan on employees and retirees? If we got together, we could all come up with other ways. But one of the key things that labor needs to do is stand together in a coalition against management and tell them we're not diminishing health benefits. Bob Lynn manipulated everybody. Aetna lied to everybody. The Aetna contract isn't what you thought it was, and neither was the last one, by the way. But now's the time. Stop. This is your future. Do not force people into managed privatization of healthcare. One of the worst things we did is agree to that. Let's walk that back. Let's stand united in fixing this, because that's really where it should be. You should not be admitting this was a bad idea and that the healthcare program should not be balanced on the backs of other people. The city has an obligation to pay. Clearly, there's enough money in the budget because the law even states that the city will pay. Their money is there. Stop giving them a free ride. Make them pay to what your people earned. Otherwise, people aren't going to stay here. And they're definitely going to speak out if you're stripping their benefits away in retirement like we did. So, Henry, I'm glad you were able to finally admit that this program is a bad idea. Now let's do something to fix it together. No one will say, we told you so. No one will say, shame on you. I mean, but let's do something. To not do something and allow an injustice to stand, that's the real injustice. Program is a bad program. It works for some people, not for everybody. The networks are narrowed. We got a document today that shows that Aetna's network has been dwindling year after year after year. 40,000 providers have left 10 separate different states. You want to know how many left New York? About 4,000 in the last year. So this is not a plan you should be forcing people on. I'm urging you, Henry, we hear you. Now's the time. Walk this back. And you'd have us to stand with you to help you figure out how to get this corrected. But this isn't the way. Learn from retirees. We can help you fight back at the bargaining table, but you don't make a deal like this. Have a good day.